Hello, everyone, and thank you for being here in this webinar. Today, I am really happy because I will talk about a really important topic and how we in ESRI are using the power of the science software to solve one of the biggest challenges that this country is facing now, the opioids epidemic. But before we dive in, let me tell you a little bit about what we call the science software. Like lots of technology companies, we care a lot about data, small bits and pieces that we collect about everything. But data needs to be analyzed in context in order to see patterns, create insights, and ultimately see the forest and not only trees. We refer to this as the science word, the power to give context to your information. Now, it all begins with answering fundamental questions like where is the problem? Where is it changing? Where should we locate our resources? And if you paid careful attention, you will see that many people is always talking about places and addresses. It is part of our lives and memories. In terms of organizational data, it is easy to demonstrate also that almost all our information is location related. But it is more than what is where. We can use geography to answer other questions like why is it there? Which implies the use of analytics to answer big questions. And then my favorite question is why do I care? To me, this is all about action. We answer the two first questions in order to determine the most efficient way to use our time and resources. And often, we want to be able to look forward so we can be prepared to whatever is coming next. All of this can be done with the science of where and applied geography. So now let's dive in the opioid crisis. As you know, today the misuse and abuse of opioids is considered a public health crisis, a crisis that recently has been declared a national emergency in the USA. These maps, for example, will show you the death rate per each 100,000 people per county from 2002. The redder the county, the higher the death rate. And as you can see, it is easy to visualize how negative trends are growing tremendously across the country. In terms of the cost of human lives, according to the CDC, just in 2017, there were more than 70,000 deaths. And that doesn't count the devastating impact on families and friends, and especially on children. This crisis is causing countless number of children to be forced into the foster care system, which already had major challenges. Regarding the economical impact, $1 trillion is the estimated US cost of the opioid crisis since 2001. Moreover, it is expected an additional of $5 billion over the next 2 years. Most of the cost has been from lost wages, productivity, and tax revenue. Now, the big question is, what can we do to fight this crisis? And what can the science of where do to help us? To illustrate this, let me tell you a story that I think will be very useful to understand this topic. Let's talk about John Smith. He lives in the city of Tempe, in Arizona. He is 21 and he's well known for being a smart student at college. As many young guys, John likes sports. He enjoys riding his bike every weekend. Unfortunately, John had a terrible accident and he broke his arm. He got treatment for his broken bone at the hospital. However, after 3 months, he still feels pain in his arm. And because of this terrible pain, he's getting depressed and anxious. So his doctor prescribed him opioids. After taking the medication, John feels relief from this terrible pain, and that producing him happiness and even euphoria. After 3 weeks taking these medications, John feels like he needs to take higher doses of it to maintain the feeling of happiness. At the end of the month, he has some more pills. The pain comes back to John with the depression and anxiety. And on top of that, he feels sick, even worse than any flu he hasn't before. John is under the effects of an opioid withdrawal. John desperately needs to take more opioids to escape this situation. So 1 month later, John becomes addicted to opioids. Finally, his family learn about his addiction. It is a devastating time for them. However, they don't lose hope and they start looking for help. John should receive all possible help. The first step is to learn as much as possible about this problem. During the last past 6 months, they have been receiving information about an initiative that their city launched recently about opioids. So they decide to find information in internet. So let's go to the web page. There we go. And let's see how John's family dive in this information. Okay, so as you can see, John's family have access to a comprehensive website where they can find different kind of information. Actually, here you will find that there are really compelling charts, but more importantly, there is information that is critical. For example, they can find information related to the commercial names of opioid pills. So now they can identify their danger. They can learn more about the evolution of the opioid crisis, and they can see, for example, that Arizona is one of the states that has suffered the most over the years. They can see that they are not alone, and actually, 4 out of 10 people in Arizona know someone addicted to prescription painkillers. But most importantly, they can understand now, they can learn more about what are the signs and symptoms of an opioid abuse. So now they have the context of this problem. They can start looking for a help center where they can find a specialist to help John. They find that the city has an easy to use treatment center locator. And just providing their address, let me put the address here, they find that there is a behavioral health center less than 2 miles away. They even can access to the directions. So they can plan a visit to this treatment center. They even find that these applications are cross platform. That means that they can use them in their cell phone. So they can find the directions of this specific treatment center and going there by using the application in their cars. Once they arrive to the treatment center, they receive care and more education on how they must deal with this terrible situation. They, for example, learn about some preventive and reactive measures, like, for example, securely disposing any opioid medication that they could have at home using the drug drop-off centers. They find that there is a drug drop-off locator for the city of Tempe and that there is a center super close, less than 1 mile from home. so they can start taking these preventing measures. Also, they learn more about reactive measures, like, for example, um, what measures they have to take in case of an overdose at home. They learn about the importance of naloxone and how they can use it to revert the effects of an opioid overdoses. They decide to learn how to apply naloxone by themselves in case of an emergency. And by using the naloxone distributor locator, the naloxone distribution locator, they can now find what is the best place to acquire the medication. Now, this is really important because this family is ready to give all the possible help to John. Unlike many other cases, they are having a comprehensive understanding, and John is receiving really the best treatment and learned help from his family. After 9 months fighting with his family, John has recovered from his addiction. The case of John is one among thousands of cases. This crisis is impacting many Americans all across the United States. Many people get trapped amidst this terrible crisis. Many other Many others didn't have that chance, the chance that John had. One of our Esri co-workers felt the impact of this crisis himself by losing his younger brother. And he put together this amazing portal where people nationwide collaborate to put a face to this problem and advocate to solve this problem together. On the other side of the story, the Department of Health, in collaboration with many other agencies, is working hard to win this war against opioids. By leveraging the power of the science of where they are collecting, monitoring, and analyzing information related to opioids. Let me show you this dashboard where they are tracking information, very interesting information, that is coming from the EMS call database. They can see, for example, easily that most report cases include age between 25 to 29 years. Also, Saturdays is normally the day where more overdoses are reported, and even they can filter this information. Let me go ahead to know even which of these cases are related to, let me go ahead here, group, to Arizona State University students. So they can start thinking what is the best way to partner with the university to eradicate this problem. In the same way, they are using different dashboards to track information related to drug deaths, naloxone deployments in collaboration with the field responders, but also they are tracking information about overdoses, information related to drug activity reports that the community is providing. So they have a two-way communication with the community and provide the community with applications where they can really collaborate with the local government. Also, in collaboration with the law enforcement department, they are tracking information of drug seizures that are taking place in the city and so on. But the city is even going further. And in collaboration with the University of Arizona, they are doing amazing things. For example, here, they are collecting wastewater from the five main collection areas to find the chemical concentration of narcotics. This information is really valuable because it could be used to track increase or decrease of opioids prevalence within the city. For example, here we can see that the area 4 is presenting a considerable increase in fentanyl concentration. This kind of analysis is possible due to the innovative character of our people in combination with the science of war. So let me put again this PowerPoint. Okay, so as you can see in the demo, we empower the health department to collect, analyze, and monitor opioid-related information so we can better understand the current situation of the community and provide treatment options in a data-driven way. We also empower the first responders and support staff so they can understand the overarching trends on the community and strategically dispose the resources. But most importantly, the RGIS opioid solution helps integrate all these efforts. So now the community would be able to access key information like preventive and reactive measures that they can take. And also, as we saw in the demo, they will be able to collaborate within the city with the city initiative through city reporting apps. And finally, all this ecosystem will provide the necessary input for the elected officials to develop mitigation strategies, to advocate grants and resources, and finally, to really solve this crisis. We believe that technology is the power to unite us, so we can be the voice of those that now cannot speak. Let's solve big problems together. Thank you.